Welcome to this explainer. If you've ever found yourself wondering how a nation of over 270 million people could possibly unify its entire healthcare system, well, you're in exactly the right place. Today, we're unpacking an absolutely fascinating architectural proposal. It was compiled by Jaka Irwanta, and it's called ASRI, or Aplikasi Sehat Rakyat Indonesia. Basically, it's designed to be an integrated digital health platform for the entire Indonesian population. It's a massive undertaking, but the way it's structured is just brilliant, and we're going to break it all down for you right now.
Okay, let's dive into this architectural blueprint. Here's our roadmap for today. First, introducing the ASRI platform. 2, where identity meets health data. 3, the patient data journey. 4, under the hood at the ASRI modules. 5, smart dashboards and AI. And finally, 6, building a healthier future together. We're going to move from the really broad concepts straight down to the actual data flow and back-end technology. All right, Section 1. Introducing the ASRI Health Platform, building the national bridge.
So, right now, a really massive implicit challenge in healthcare is fragmented data. Think about it. Your local clinic, your hospital, and your government insurance like BPJS, they often just don't communicate smoothly with one another. Well, ASRI fixes this by acting as a National Health Information Exchange, or HIE. Simply put, it's a centralized platform bridging health data exchange across all facilities, all while maintaining strict interoperability and governance. The main goal here? To create a longitudinal health record for absolutely every single citizen. So instead of your medical history being scattered in paper files across 5 different doctors' offices, it's all consolidated to support comprehensive national health programs.
Moving on to Section 2, Identity meets Health Data, the Bouncer and the Vault. Now, for a system this massive to actually work securely, we have to cleanly separate identity verification from the actual storage of a patient's medical history. Think of Decouple as the bouncer at the door. They hold the master data and ICAT. They're the ones verifying your name, your date of birth, your photo, and your address, securely checking your ID. ASRI, on the other hand, is like the highly secure vault holding your actual health data. It functions as the health exchange and national repository, securely storing those medical records. So Decouple verifies exactly who you are, establishing a single source of truth, but they don't hold your medical secrets. The medical data itself stays completely locked within the ASRI platform.
Next up, Section 3, the patient data journey, from walk-in to national profile.
To make this abstract architecture a bit more concrete, let's trace a literal journey. Imagine a patient walking into a hospital. Step 1 is registration. The patient hands over their NIK, and ASRI instantly asks Decouple to verify their identity. Once verified, boom, a national patient ID is locked in. Step 2 is BPJS data integration. BPJS instantly sends over previous medical checkup vitals. We're talking things like blood pressure, cholesterol, BMI, and vaccination history. Then, Step 3, the hospital examination actually begins. The doctor conducts the checkup, and all the new diagnosis, prescriptions, lab results, and radiology reports are saved directly into the ASRI repository. Finally, Step 4, it all merges. Every single piece of this data flows into one unified national data profile.
All right, Section 4, under the hood, ASRI modules, or the engine of interoperability.
Let's pull back the curtain for a second and shift our focus to the technical modules that make this seamless data journey possible. First up is a true game changer, the Master Patient Index, or MPI. This is a system module that actively prevents duplicate records. How does it do that? Well, by linking a patient's NEK, their BPJS number, their hospital medical record number, and their clinic number all into one single unified patient identity. This is absolutely massive because it solves that long-standing, incredibly frustrating problem of having fragmented patient identities scattered across dozens of different clinics and hospitals. Now, what's really interesting among these core ASRI modules is consent management. While the system uses modern standards like HL7 FHIR and REST API for the health data exchange, consent management means the patients actually have ultimate control over who sees their data. For example, you can grant Dr. A access to your records, deny Dr. B, or maybe give Hospital X access for just 30 days. And every single access request is recorded in an unalterable audit log, so you remain completely in the driver's seat the whole time. Of course, none of this works without an absolutely airtight digital fortress. The backend runs on really robust, scalable frameworks like Java Spring Boot, .NET, and Node.js, utilizing databases ranging from PostgreSQL all the way to MongoDB for medical documents. But the security layer, that is the real star here.
This Kubernetes-based cloud infrastructure guarantees patient trust by using AES 256 encryption at rest. That literally means your data is locked down with military-grade security when it's just sitting in the database, and it uses TLS 1.3 to protect it while it's moving through the system. Add in role-based access control and OAuth 2 authentication, and you have industry-standard, secure pipelines protecting every single byte of health data.
Which brings us to Section 5, Smart Dashboards and AI, Population Analytics.
So what exactly happens when you have this massive, highly secure repository of encrypted, unified data? Well, you can safely utilize it to generate actionable medical insights. The ASRI system actually generates tailored dashboards based on who is securely logging in. For the doctor dashboard, physicians get immediate, life-saving context. At a glance, they can see the patient's identity, full medical history, lab results, allergies, past operations, and even an AI-generated risk score. On the flip side, the government dashboard looks at the macro picture. It strips away all personal identities and just displays aggregated epidemiological data, things like medical checkup counts, disease distribution, and health risks per region. This allows the government to execute incredibly accurate healthcare budget planning.
On that macro level, the ASRI platform features a sophisticated AI health risk engine. It calculates individual risks for severe conditions like diabetes, hypertension, stroke, or kidney failure. Then it rolls those individual scores up into aggregated population analytics. So a government official looking at these aggregated population risks might see, say, a 45% hypertension prevalence and 35% diabetes prevalence in a specific province. And that means public health resources, funding, and educational campaigns can be deployed exactly where they are needed most.
And finally, Section 6, A Healthier Future Together, the Ecosystem Impact.
Now, you might be wondering, why does this matter to you? Well, because everybody wins when true interoperability is achieved. So the crucial point is that for the government, they get real-time epidemiology and highly accurate budgeting for the early detection of chronic diseases. For BPJS, claims are verified much faster, and they completely prevent paying for duplicate services. Hospitals gain complete patient records across facilities, which dramatically reduces repetitive testing. But most importantly, the public, that's you and me. We get one NIK identity for faster, safer service. The general public ultimately receives far better care because their doctor has the full picture instantly without ever sacrificing privacy. I want to leave you with this final provocative thought. With one NIC unlocking a safer, faster, and smarter healthcare journey, how quickly can Indonesia achieve true health interoperability? The architectural roadmap compiled by Jaka Irwanta proves the technology, the governance, and the vision are already here. It's really just a matter of building the bridge. Thank you so much for joining me for this explainer. I hope you found these insights as absolutely fascinating as I did. Keep learning and keep asking the big questions.